Fighting the opioid crisis in Tennessee has gotten even harder during this pandemic. Just take a look at the increase in the number of deadly overdoses in Nashville since the start of COVID-19 compared to the same time period last year. If that isn't enough, News Channel 5's Matthew Torres tells us a new drug has officials very concerned.
This new synthetic opioid first appeared in East Tennessee in January, and while the number of cases is small right now, health officials in Davidson County are already keeping an eye out.
Everything gets complicated and more complicated and more complicated.
But Metro Opioid Response Coordinator Trevor Henderson worries the job will get more complicated. He's been analyzing fentanyl as the major driver of overdose deaths, but he fears a new drug just as strong, if not stronger, is on the horizon.
Things are an awful lot more difficult for public health and first responders and hospitals, so it's very concerning.
This month, he's been alerting local law enforcement and the medical examiner's office about isotonitazine, a synthetic opioid that hit the U.S. last summer, but it finally reached Tennessee and Knox County this year.
We still have many cases from April 24th to now that we're still waiting on toxicology results on, so we expect those numbers to rise.
Chris Thomas is with the Knox County Regional Forensic Center. Since January, there's been 8 deadly overdoses that had isotonitazine in their system.
Typically, these drugs have been combined with other drugs. It's not that this is the only thing we're finding in their system.
It's so new, more research is required. It's not even in the DEA's list of controlled substances or emerging threat report. But public health officials warn it has the potential to cause widespread harm.
It shouldn't be ignored. While it is in a minimal amount of cases, it's one of those things, if it's left undocumented, unregulated, unresearched, it could easily take over.
Even though there are no known cases in Nashville so far, Henderson's already asking first responders to be ready to keep track.
The fact that I'm alerting our partners to start looking out for this, I think tells you that I would expect that we will see it. To what extent, we do not know.
The Metro Public Health Department has now asked the medical examiner's office to start screening for this drug. It was so new in Knox County, it needed a more expensive and specialized testing to confirm the drug. Reporting in Nashville, Matthew Torres, News Channel 5.
Thanks, Matthew.